Sorry, your time is up. Thank you. Next we have on the list Susan Dinsdale. Is Susan in the... Okay.
We have Dr. Deming. Dr. Deming. We have Dr. Deming, then Susan.
Okay, we'll take Dr. Richard Deming next and then Susan Dinsdale.
Okay. Sorry, Susan. Thank you. Good evening, Mr. Chairman and members of the state legislature. I'm Dick Deming. I'm Medical Director of Mercy Cancer Center in Des Moines. I'm also the elected president of the medical staff, and I'm a volunteer for the American Cancer Society. And I list those hats. I know all of you have many hats, but those are all relevant to what I'm going to say tonight. I read with great interest Governor Brandstadt's op-ed piece in the Des Moines Register outlining the Healthy Iowa Plan. And I appreciate the fact that he quoted President Obama about healthcare reform and the need for reform. I also appreciate the governor's presenting a plan that is innovative and addresses the inadequacies of Medicaid. I firmly believe Medicaid is inadequate and needs improving. I also appreciate Governor Brandstadt's attempt to develop, as he says, an improved health care program for the neediest Iowans. I agree with health care reform. I'm all about personal responsibility and accountability. But I'm here to speak in favor of Medicaid expansion. And my talk is going to be about three things. Number one, passion. Number two, practicality. And number three, compromise. First of all, passion. You're not going to have a health care system that works without access. And my passion is about access. As a cancer doctor, I see every day people come into my office who have no means of support, and it's not until their early stage cancer becomes late stage cancer that they have enough symptoms that they say, "Uncle, help me." And they come and we treat them, but we've lost the opportunity to cure them. Without access, we don't have prevention, we don't have early detection, and we don't have the opportunity to cure cancer. It's about access. I've never ever turned down a patient because of lack of insurance or the ability to pay. I never will, regardless of how you vote. But if people don't have access, they'll come to me with a diagnosis that I won't be able to cure. So it's not about my paycheck. It's about human dignity and social justice. Second, practicality. From a practical point of view, this is the right thing to do. You've heard many facts and figures, but have you heard that Iowa has already left $178 million in Washington as part of Affordable Care Act? We have agreed to 2% less money that the hospitals are reimbursed on Medicare. That's to pay for this expansion of Medicaid. If we in Iowa...
Thank you, Dr. Deming.
Thank you.
Your time is up. Thank you. Next we have on the list Susan Dinsdale.
Thank you for this